always felt like I had a connection with senior pets. The seniors kind of get overlooked sometimes. They're just getting older, they're going to slow down, they're going to get sick, these things happen. That didn't really sit right with me. Yeah, they're getting older, but that doesn't mean that they have to be in pain. That doesn't mean that we stop taking care of them. And arthritis can start as early as a year old. Most people don't understand that limping is actually one of the last signs of arthritis. There was a study done in dogs under the age of 4 that said 40% of them had arthritis. Obesity does cause a 4 times higher risk of having arthritis. Now, Western medicine is very reactive instead of proactive, and I am hoping a lot to change that. A Western appointment where someone comes in and says, that I'm just not comfortable with that medication. And I say, well, I guess your dog's going to be in pain. And that's the end of the conversation. Like, there's not much else I can do. In my world, I have tens of other options. I just have to find what they're comfortable with.
Welcome to the DAFY Podcast, the place where you will get expert-led and science-backed advice on dog health and nutrition. No more confusion and no more conflicting opinions. Just clear guidance to help you make informed decisions for your pup. Because when it comes to our dogs, they deserve the very best care. And we, as dog parents, deserve confidence in the choices we make for them. Let's meet an expert. Amanda, welcome to the DAFY Podcast. It's so great to have you on today.
Yeah, thank you so much. I'm very excited. I appreciate you giving me the opportunity.
Yeah, I was so excited when I found you because there are not that many wonderful vets that are specialized in kind of senior pets out there. So how I wanted to start it really is, the first question is, why is it that your journey brought you to become a vet specialized in senior pets?
Yeah, I always felt like I had a connection with senior pets. I think their want to just kind of be around and relax, and the very calm demeanor of most of them was something I really enjoyed. Puppies are wonderful, kittens are wonderful, but they're a lot sometimes. And I felt like the seniors kind of got overlooked sometimes. So there were definitely moments where, especially in adoptions and things like that. But as they get older, the thought process was always, oh, well, they're just getting older. They're going to slow down. They're going to get sick. These things happen. And that didn't really sit right with me. So I felt like, yeah, they're getting older, but that doesn't mean that they have to be in pain. That doesn't mean that we stop taking care of them. If anything, at this stage, we've cared for them for 10 years and they're a part of our life, right? So it was, to me, just something where I felt like there was a need. And as my personal senior dog got older and we started to have more complications with him, I felt like there weren't a lot of resources for me to go to. Even as a veterinarian, I didn't know what to do. The caregiver burden, the caregiver fatigue, I felt alone in a lot of that. Even with family, a lot of times they don't quite understand what you're going through and the connection that you have and everything like that. So I felt like there just wasn't, I kind of felt alone in that journey with my dog, and I don't want people to feel alone. I don't want them to feel like they don't have choices. I want people to understand all the options that they have, and I want to give them all that information and make them feel empowered and comfortable and able to make whatever decision they feel like is best for their senior pet, and to keep them comfortable, and advocating for the pet parents and advocating for the pets. The idea is we just want them as comfortable as long as we can. And I want, obviously, them to feel as comfortable as they can for as long as they can. It stemmed a little bit from my heart dog and just seeing this opening where there needed to be more data, more care, more information for people.
Yeah, I completely agree with you. It's so I see it all the time. Like, everyone just wants to look at the puppies, but actually when it's your own dog and you just look at them and they start becoming seniors, that's really when they need you the most. Because as puppies, most of the time they're healthy, adult dog, they're healthy, their life is really good. But then actually that's look in their eyes when they start becoming senior, and you can start seeing a little bit of signs of pain and a bit of, that's when they look at you that way to say, just please, just give me that attention because I need, your time more than any other time. I ever needed you, basically. So yeah, it's just beautiful, isn't it? I love that. And I love how your own dog kind of helped you make that decision as well. I'm sure that, yeah, that must have been an amazing connection that you had.
Yeah, it was really nice. And I think one of the things that I get to do now that he's passed is to still have a legacy for him in this way where I get to help other people and it makes me still feel connected to him and everything like that. It's a nice way to say that, he molded my life a little bit, my career a little bit. And I get to help a lot of people because of it.
I love that. I love that so much because it resonates with me so much. I started what I'm doing because of Rusty, because he's my soul dog and I would just do anything for him. Monet, I don't care about anything, but he's just my soul dog. And it's beautiful how you say it because you always think, what is it going to be like when he's not there anymore? Is this all going to be like the same? Would you be like, how will I feel, right? Because everything I do today is because of him. And the legacy part is the one that we tend to forget sometimes. And, you're going to carry on and just help more dogs, help more animals, and in that legacy, really, right? To honor them and to honor their life and, the love that they've given you. So it's beautiful.
Right. And I think one of the hardest things as, caregiver or a pet parent is to know that, most likely we're going to outlive them. Right. So, that is very scary. And a lot of people just want to say, oh, I don't want to think about it. And I get that. But at the same time, we do have to think about their aging process and we do have to make sure that we're doing the best by them in that moment. Happiness is lived in each moment, not thinking about the past or the future. So I think it's important for us to be in that moment with them, enjoy that moment, know that, yes, there's going to be a moment where they leave us, but they're going to leave us with a lot of lessons learned and an ability to, if we choose to better other animals' lives because of that, or to better our life because of that. And they will have a legacy that goes on. So, they don't really leave us unless we let them, in our hearts. It's just that their bodies have to move on because they've given everything that they need to give here and they get to pass on.
Yeah. Oh, it makes me emotional, honestly. It's so true, though, isn't it? It's honestly so true. I recently lost Rusty's best friend, who was a little cubby as well, like a month ago. And that's exactly what it is, isn't it? Their body's not there with you, but they'll just live forever in your heart, and that's never going to go away. But it's hard, isn't it? Because grief is, it's kind of like I read somewhere, right? Like you start grieving your dog even before they pass, like that connection that they have. And I tend to tell my husband all the time because he knows, I think as women, maybe we get even more attached to dogs. I don't know, we're like more emotional than men. I don't know if that's the case or not, but I have a relationship with him that is so strong. And not many people can understand it. That's the reality of it. Unless you really have that kind of love for your dog, it's just really hard for people to say, why is it that she loves that little thing so much and she'll do anything for that dog? And it's hard because I often say to him, I think I will need to start some kind of therapy before like he passes, because I don't know, I cannot see my life without him right now, like in the
Right.
future ever. And I know that you will, because you lost your pup, but it's hard, I think.
Yeah, the anticipatory grief component of it is huge. And I have a personal friend here who's a veterinarian who does a lot with anticipatory grief and how to handle that. I have another friend who does some pet loss therapy after she lost her dog. So she has a community under pet loss as well, because yeah, you do feel alone. A lot of times you do hear just like, it's just a dog, you feel silly for crying or being so upset over your dog or cat. And it's not silly. They were a part of your life, like more so than some of your extended family. They lived in your house. They depend on you.
Yeah.
They need you. And, they are a part of your everyday, and then they're just gone.
Yeah.
And it's really hard to compensate and to handle that
Yeah.
huge change.
Yeah.
So yeah, I think it's really important to understand that they are a big part, and the anticipatory grief is something that definitely can have some need to reach out to other people for.
Absolutely. Yeah. I love that there are people out there that do that as a job, to how to deal with these kind of things in life. I'll ask you later about it, but yeah, I'd love to talk to these people as well, because I think that's such an amazing job as well to have, isn't it? And yeah,
Yeah.
like you said, right, is people go through it themselves and they're like, they actually realize that there is such a need out there for that. I love it. Yeah. I love it. So cool. So I don't want to move away from the topic today, but I love to talk to you anyway. So we are going to be talking today about a quite big kind of like a chronic issues that senior dog, but also young dogs have nowadays, which is arthritis. And I actually haven't done a podcast on arthritis. I've done quite a few on kind of senior dogs, and they kind of like typical long-term conditions that they get as they get older. But arthritis is not talked as much and it's out there, right? So the first question really is, when we talk about arthritis, there are loads of things out there: osteoarthritis, arthritis, hip dysplasia. There are loads of different things that are kind of in a way related to arthritis, I guess. But when we talk about arthritis, what is it? What do we mean?
Yeah, so when we're talking about arthritis, we're talking about the space between two bones. There's this joint space, and it has all this nice fluid in there that keeps things lubricated so that you can bend and move exactly how you need to. And as these guys get older, we notice that all that fluid that's in there maybe starts to wear down a little bit. There's not as much of it. It gets older and doesn't regenerate as well. And then we start to get some inflammation that builds up in that area. And that inflammation can cause bone spurs and, all these little deposits in there that make it painful for them. So it really is just like a pain in the joints that happens through the aging process. There's a little bit more new information now that says that even arthritis we know can start as early as a year old. There was a study done in dogs under the age of 4 that said 40% of them had arthritis somewhere in their body. So they're not obese. Obesity does cause a 4 times higher risk of having arthritis, but, just in general, the general, population can have a large amount of arthritis before they're even considered a senior. The thought process is that when they're younger, they deal with it a little bit more. And as you get older, you've been dealing with that pain for so long that the chronicity of that pain does start to cause more outward signs that we see. So a lot of times it can be something they're dealing with for a lot longer before we really start to notice pain in the clinical signs, because they're just so good at hiding those signs.
Yeah, it's interesting what you're saying about hiding, isn't it? Because it's so common, right, that like a dog owner would take the dog to the vet and they get diagnosed with arthritis, and most of the time they might not even had a clue about the dog having arthritis, and the dogs are just very strong essentially, and they don't show to you quite a lot when they are really in pain. And that's kind of like the thing, I don't know, is that the thing that kind of masks it so much and it takes like a long time to get diagnosed? What are the things that I should be looking at to kind of makes me think, oh, I might need to book an appointment to do like a proper check?
Right. So I think early signs are really important to look out for. Most people don't understand that limping is actually one of the last signs of arthritis. So when our pet starts to limp, like they probably have arthritis that they are not able to compensate through anymore. So that's something we see, further in the diagnosis. Earlier things that we're going to see are just, behavior changes potentially. So, I pet down their back and now they seem a little bit uncomfortable when I'm doing that. If they go run around in the backyard, maybe they're not wanting to do that as much. They're not making as tight turns anymore. They're not, taking off as quick as they used to. If they're going up and down the stairs, maybe instead of just running in the house and running up the stairs, they run in the house and they stop and they look at the stairs and they're like, huh, and then they go up. So that like small amount of hesitation, it's hard to pick up on, but you can definitely see the changes if you know what to look for there. My dog, she's 9 now, 9, 10. She was rescue, but she has started when she gets up on the couch, she used to just jump up on the couch. And now she kind of puts her front feet up first and then she like slinks her back legs up. So I can tell with her that something is painful, and it's just a matter of trying to figure that out. So it is more of these subtle changes, especially when we're getting into, at least here, it's getting into the colder months. So we're getting into the point where they'll get up first thing in the morning and they have to kind of like do a lot of stretching. There's a lot of like, gotta crank these little joints out and get comfortable. And it's a lot more than it used to be. And after about 5 or 10 minutes, they may be going and everything's moving and they're good. But if they lay down for a couple hours, when they get up, they have to do that like big stretching again. So So we'll notice like more periods of that, seeming uncomfortable when they're laying down. They used to just like plop down and now they kind of slowly go down. So we're looking for very subtle changes and they can be very easy to miss. But those things, just knowing what their normal looks like and then being able to pick up on these very small changes that, hey, they just slowed down a little bit when they're doing this. And I see that in clinical work too, because anytime I have a senior, I go into the room and I say, hey, do you have any concerns? And most of the time people will say, no. And then I say, okay, well, when, Max wakes up in the morning, do you notice now that he's like stretching it out a lot more than he used to? Or is he a little bit slower on the walks now? Or like he seems like he can't go as far. He's lagging behind a little bit on the leash instead of being right there with you. And they were like, well, yeah. Well, that's arthritis. That's our earlier signs that we need to pick up on, because the earlier that we do get treatment implemented, the more that we can combat that before it causes a lot of bony changes.
Yeah, it's such a good point that you've made there about, being in the clinic and you kind of having to dig in with the owner and ask those further questions. And I feel like with Rusty being 6, again, I always put into my kind of like in my head, in my scenario of what other kind of dog owners my experience is. The vet normally checks him on his joint, things like that, but I never get asked any of these questions. So it's kind of my point that I want to bring to you is, do you feel like every dog needs an Amanda in their life, or every senior dog needs an Amanda in their life? And how could that be made, like, how can we make it accessible to all the dog owners, right? Because it's like, I feel like if I go to my normal vet, you do not get that kind of service. You get a 15, 20 minutes consultation. I feel like that can be misdiagnosed in a way, buried under the thing, like, because it's like no one really asks you these questions to diagnose that, right?
Yeah. And I think obviously we know it's no secret. I know the UK is going through a process right now of having vets have to give prices for things, which I think is interesting. We do here regardless, but there's a lot of corporations taking over. And with that comes a lot more quantity pushing when it comes to clinical practice. So those appointments are getting shorter. They're becoming 15, 20 minutes when they used to be 30, 45 minutes. And that's a big component of what I want to bring to vet med in general are, helping with the pet parents, because that's where my heart lies with helping them and their senior pets. My process in January, we're going to have a class that they're able to take, a program where it's going to be 6 weeks, and they get to go through all these questions that they should be and really feel confident about being a senior pet parent, because the needs are different as they become a senior and the vet visits don't really change. So I do think that there is a gap there where people really need to understand what has changed from their pet from the time they are 6 to 7, right? There's a huge change, and we really just need something to fill that gap. So that's what I'm hoping that program can do. And another component is helping pet clinics. Like, I think we should have geriatric exams, and we are trying to push that more to a lot of clinics, senior pet exams where we call an owner and we say, hey, Max is due for Rusty's due for his annual, but this year he's said technically he's considered older, and we would like to make his appointment 45 minutes instead of 15. With that, we're going to go into a lot more depth about what's going on with him. But, there is going to be an additional charge for that. So instead of being a $65 visit, it's going to be a $95 visit. Are you comfortable with that? And would you like to, have that longer time frame to spend with the doctor and to talk through the changes that may be going on with Rusty? And it's not that much more time, because it's just a little bit more time when someone's making an appointment. It's just a little bit more for the receptionist. And if you can compensate financially for that longer appointment, I think we can catch a lot of things that are going on before they're big issues. And Western medicine is very reactive instead of proactive. And I am hoping a lot to change that and allow us to be a little bit more proactive with things and to catch things earlier before we don't have a lot of options or before we have to max out all of our options, So if we're able to catch things earlier, animals are living longer, but we can help that even longer and more comfortable if we're able to do a little bit better job with that. So I think, in short, my hope is to help, progress this where it's something that there are senior appointments when your pet goes in. I would love for that to be common, but also understanding that, just really knowing that your pet is a senior at this age and their needs change. And there are scales that you can look at. There's pain scales. There's 5 or 10 different pain scales that are available for dogs and for cats. And they're great to start with a baseline to just go into and read through things, and you'll be surprised at what you do actually notice is a change. And a lot of them have a quantitative value. So you get that value, and then a month later, you can go back and get the value again, and you can see little changes. And just being able to read through that helps. Journals help, say, oh, hey, today it was rainy and cold, and Rusty seemed a little, slower today, or he didn't eat his food as quickly as he normally does, or like he seemed to not be able to get as comfortable as quickly. Like he was pacing a lot more, and he kind of would like lay down and get up and lay down and get up, and just didn't seem like he get really comfy, and just keeping a notes app or something like that where you're keeping a log of these things, because we put it in our head and then like 30% of it sticks and we forget it, so being able to, for pet parents to just know they are different, try to keep a log of that if you're able to, and do these pain scale calculators even if you don't think they're in pain, because you might be surprised.
Yeah, I love that. I absolutely love that. And actually, I've recently spoken with an holistic vet in the UK. Her name is Sue Armstrong, and she did a talk at an event back in March, and she referenced this thing about doing keeping a timeline with all the different events that are happening in your dog's life. So on the top, I think you put all the things that the dog gets in terms of medications, infections, ear infection, what medication he had for that, vaccinations. And then on the bottom is like little thing, exactly what you're mentioning. Oh, he woke up this morning, he was limping a little bit from his back leg. Or he woke up this morning, like you said, he wasn't hungry. Or he was running, and he was running, his back legs were both like a rabbit, right? Like it looks like he was hopping or something like that. So it's just like having that timeline with the dates and when that's happening. And then, the best thing you can do, because you can only do that as a dog owner, the vet is never going to know your dog as much as your dog as much as you do,
Right.
because you live with your dog. You see how your dog behaves 24/7. So having and keeping a timeline or a log is the best thing that you can bring to a vet to be able to diagnose any kind of condition, especially when they don't have an hour of time every time, or to talk to people like you who will have the time and is specialized and just give you way more context than just, oh, it's limping a little bit every now and then. So I love that. Absolutely love that.
Yeah. And I mean, obviously, we all go into this profession because we love animals and we want to help them, but it can be hard when you have to see 1,000 pets a week, and, some of them are sick and coding in the back, and some of them are hospitalized with diseases that may, be their demise, and you're juggling all these things. So it can be hard for us to go into every appointment and then, okay, I'm going to switch on my senior pet right now. Okay. So I need to ask you questions about dementia. I need to ask you about questions about arthritis. I need to ask you these questions. One of the things that I would love to implement for clinics is to have a checklist to go in with, once we have this like little thing that says, okay, Rusty's a senior. When you step into his exam room, which I would love to have senior friendly exam rooms, it's another topic, but to have just one sheet of paper that says, are you noticing any of these changes? And it's just a simple checklist. And that doesn't take a lot of extra time, but the technician, when they go in the room, can be able to look at her, and then based on those questions, maybe pick up on, Dr. Amanda needs to talk to them about maybe some dementia or cognitive decline. And it's a more streamlined way to be able to have that conversation and to know what's going on. Yeah, I mean, a lot of it is just everyone knowing, and pet parents knowing what questions to go in with, and having that knowledge to just be aware to ask those questions.
Yeah, absolutely. I love that. I absolutely love that. I think that should be in every kind of like vet practice as a service offered, the moment you have because every pet, I mean, they say for senior pets, you should go in twice a year, right? To do a health check twice a year, and just have the dedicated hour slot with a checklist, with a vet that really understands. It's kind of like has a bit of a specialty in senior pets. And then, just go through that checklist. I think there are so many things that can be picked up beforehand. I tell you another story is that I think I mentioned it to you. I ran a doggy daycare and boarding business for 3 years. So I've seen like 200 different type of dogs, right? Different breeds, different age, different health issues. And I had this border collie that came to me, I think 2 years ago in December, and he stayed with me for a week. And he was like 12 years old, playing like a typical border collie, like you could throw the ball, he will bring it back to you no matter what. You sit down, here he is with the ball in his mouth again, play with me. So you look at him, and in a million years, I would have never ever said that dog was in pain, ever. Fast forward 2 weeks, Fiona messaged me and she said he had to be put down. And I was like, what? And she said 2 weeks after it was with you, we did like his health check, regular health check. We did a blood test. His liver came back, or something, liver enzyme, something came back like out of the norm. Anyway, he had liver cancer. And and there was nothing they could have done. It was so advanced. There was nothing they could have done to fix or to try and work on, because it was so advanced. Within literally days, he had to be put to sleep. And it just goes to show, right? Like, how long could that cancer been there before it got to the point that the dog had to be put to sleep? The cancer doesn't develop in weeks, right? It develops in years. And it just goes to show, like, we do not get that in general, like as dog owners, the level of care and details, and to diagnose exactly what you're saying, right? Where you've got blood tests done all the time, where you've got like a checklist of little things that you will know was wrong by just checking that and talking to the owner. So yeah, I totally agree with you. I love that. And so a question for you then is that you are in the clinic, right? And you get a senior kind of pet with suspected arthritis. What does an initial assessment look like from your side? And what does the owner need to look for from the vet to make sure they're asking the right questions to get the right level of diagnose for that dog?
Right. So on our end of things, obviously a good physical exam is important. I would love for us to be able to, as we get more thorough at exams, we're able to do like a neurologic exam with that, and that's a lot of times checking the functionality of the nerves to the end of the toes to connect with the brain. Like we're flipping over the feet, we're seeing if they flip them right back over, those types of things. We're checking their cranial nerves. Those are quick things we can do as we're doing a 5-minute exam. And another thing is muscle condition score. So when we're looking at these guys, we can actually measure muscle condition. And I think just as important as body condition scoring, where we're measuring are they ideal or obese or underweight, we should be doing a muscle condition score. So we should be doing an MCS. Yeah. So, and there are scales that you can find. There's plenty of pictures and scales and things like that. It typically goes from a 0 to a 4. And it's a very clean way to just say, we're starting to have a little bit of muscle wasting, because we know as seniors get older, they can start to have some muscle wasting, either from improper nutrition, not enough protein in their diet, not enough exercise, not enough movement that's keeping those muscles built up and everything, or from pain and disuse overall. So I think just a muscle condition score is a really nice little back way to go, hey, something's maybe going on here, and we can look a little deeper and be able to figure that out. So from our end, I think it is important for us to take on that and to be able to ask those questions if we notice changes. And then, we're checking, obviously, we're bending and we're moving, and we're seeing, is there what we call like crepitus or crunching essentially in those joints? Is there thickening of the joints? Is there heat associated with those joints? Is there pain? Obviously, when we're doing that. So we pick up on those little things. And then questions, obviously we went through questions to ask owners. And our ultimate diagnosis of arthritis is on radiographs. So we're looking at x-rays to see, are there changes in the joint spaces, wherever that may be. And it can be really frustrating and difficult, because if we don't have a very good physical exam, I can't just x-ray your entire dog. Every time you come in. It's not really rational, or it doesn't make a lot of sense. So if we're not having set pain somewhere, screening x-rays are not always on our docket of things to recommend. So I think it is important for us to have that really good physical exam on, the front end of it, and to talk to owners about gait and watch their gait and things like that too. Dogs that are in pain tend to have very short steps. So you'll notice more that they're having like short steps and they're not really bending their knees as much. Sometimes they look like they're walking on eggshells, and sometimes we get some hind end changes that are going on where they actually look like they're long steps where they're dragging, or they're kind of, their back end doesn't seem to know where it is in space. So I think it's really important for us to make sure that physical exam on those seniors is appropriate, and we are accounting for muscle condition, neurologic exams, a good orthopedic exam, and all of that does fit within a 5 to 10 minute physical exam if we're doing it every time.
Yeah, that's so interesting. And it's interesting that you think about X-ray. Obviously, is not the right thing to do it all the time, because obviously the dog needs to be potentially sedated, and things like that. It's quite interesting though, isn't it? Because it's like the only way for them to, like, for the dogs to show it to you is if they're like stiff. That's pain, isn't it? So kind of like it makes me think like, to diagnose arthritis, first thing, it's like, how can you, in my head, it's like, how do I prevent that from happening in the first place? Because I feel like loads of dog owners that have dogs with arthritis or any other kind of joint conditions, they feel very guilty straight away, right? They're like, oh, have I done something to cause that? And so do you think is arthritis linked to, or osteoarthritis linked to like genetics? Or can it also be linked to things that we as owners can avoid for them to happen in the first place?
Yeah, I think there can be multiple ways. Congenital, obviously, people think of things like hip dysplasia as an old dog disease, but it's not. It's a young dog disease. So that's something that happens when they're diagnosed by the time they're 2 years old on X-rays. The hip dysplasia itself is just an irregularity in the way the hip sits in that socket, right? But what happens secondary to that is all that rubbing, and then the arthritis comes in, and we are, diagnosing the arthritis component of the hip dysplasia when they're 8, because now they're clinically having signs and they're painful and we're treating it, but they've had it for years. So I think there are definitely congenital components. Hip dysplasia, elbow dysplasia, intervertebral disc disease is common in like beagles and Dachshunds and things like that. So there are breeds that are going to be predisposed to certain types of arthritis or bony changes that can cause arthritis. And then there is the aging change component of it. Just like with people, 80% of dogs of the age of 8 have arthritis in at least one joint. 40% of dogs by the age they're 4 have arthritis in at least one joint. Like, it's going to happen. And I think it is important to make sure that we're approaching conversations in the right way, because sometimes, vets and pet parents can both get a little bit reactive when it comes to certain conversations, because from a veterinarian standpoint, it's like, I just want to help. And I don't know how to make you understand that there is pain here. And, a lot of times we'll go in and say, well, panting could be a sign of pain, or, when they're doing these things, that could be pain. And a lot of times pet parents don't want to think that they missed it, right? So there's a level of shame where they think, no, like, I would never miss that Rusty was in pain. Never. And it's not that you would do that on purpose. I absolutely don't think that you would. It's just that we don't always know what's going on. And it's, if we don't know what we don't know. So it's impossible for us to be able to pick up on everything. And that's where that vet client relationship needs to be very strong. And I always say, if you don't trust your vet, find a new one. I don't care. If it's me, if you don't trust me, find a new vet, because the relationship that you have with your vet is going to be paramount in the treatment of your pet. They're going to get better treatment if you trust your vet and what they say. And if you can have good lines of communication between each other. So I think that there definitely can be some disconnect, and we just have to work on our communication skills to be able to say, like, you're not failing by any means, but there are things that we can communicate better on to pick up on these small changes, and we can get Rusty treatment. We can get him feeling better earlier than having to have this back and forth and maybe not understanding or being afraid of hurting someone's feelings and things like that. I think there are appropriate ways to have those conversations. I think psychology is very interesting, and I think that as veterinarians, we should probably have to minor in psychology, because there is a big component of it with that. It's like pediatrics, that's someone's baby. So I think it's very important to make sure we're having that conversation in a way that's going to make pet parents want to continue that conversation, as opposed to just shut down and react. And I think from pet parents as well, understanding that, like, you're not going to catch everything and you're not supposed to. And that's okay, because that's where that connection with your vet needs to come in.
Yes, absolutely. Yeah, I love that. It's a little bit like obesity, isn't it? It's like there are so many obese dogs out there. But as dog owners, we don't necessarily see that or actually see the implications of it straight away. And it's, I guess, from a vet's perspective, really a tough conversation to have to say to someone, your dog is overweight when, like, it will come out of love and overfeeding them treats, overfeeding them food. But like you said, psychology plays a big part because it's how you talk to a dog owner and, let them understand the implication. I always try to reference studies of, for example, obesity. What is the implication of a dog being obese? Actually, there is a study done on Labradors that proves that, dogs that were overweight live less time. So you were just going to lose that. But it's really hard to just let anyone, like I see lots of people getting defensive straight away. And I saw that with my clients coming to me saying, yeah, the vet said you need to lose 2 kilograms. And it's like, like very defensive. And like, they're just trying to make sure that, you're going to avoid issues later down in line. And yeah, but they don't necessarily see that
Yeah.
because treats equals love.
Yeah. Exactly. Yeah. Yeah. And I think, we don't want to take treats away from that relationship because that is part of your bond is to be able to give them treats. But maybe we just talk about, okay, well, we need to do healthier treats, and healthier treats are better anyways, because one, they're probably cheaper, two, they're probably fresh, and three, they probably have better things for the body and the brain anyways. So let's do some antioxidants, some berries, if they'll do sweet potatoes or things like that, that's great. And then you don't have to worry about buying expensive treats, and you have simple things that, you can eat and the dog can eat. And it's okay to be able to share those things, and they're less calories. And overall, that's just going to be better. So yeah, the conversation just needs to be a little bit more, I think, where we are able to just say, I get it, but it is my job to tell you that obese dogs are 4 times more likely to get osteoarthritis. Obese dogs are more likely to be clinically obese, which means that their body and their cells are obese, and they're more likely to get things like diabetes and Cushing's and thyroid disease. Certain cancers are linked to obesity, and that it's important for us to get them to an ideal weight. Not that you're doing something wrong. We all wind up getting there at some point, an accident. We don't think about it. And, so it's okay, but being able to get them back to that place where if they're a little bit lean, their joints are going to be a lot more comfortable, and they're going to live longer, and we're just going to get a much better quality of life. And as a veterinarian, I'm going to see you less because they're going to be healthier. So that's saving you money and all positive things.
Yes. Yeah, absolutely. I agree. And that's what I love about talking to integrative vet, because you're seeing kind of both ends, right? So it's like, how come, help them when they're sick, but also what can we do to avoid things happening in the first place, and really put your preventative hat on. And that's really nice. I think, if there could be more integrative vets out there, because there is such a big differentiation, right? So you got holistic people, you got conventional vets, and then you got integrative vets in between. Integrative vets are the perfect scenario of a vet that I would be looking for personally, because I feel sometimes, you do need medications, like I had Rusty with ears infection, eye infection, he was really poorly. You do need medication sometimes, but I'm also very, like, I don't like to overload him with medication because I know that, long term it can impact his organs and things like that. And so if you can find an approach that works in between, I think that's when you have a winning scenario in this industry.
Yeah, I think that is really important. And I think from my perspective of, pursuing a more integrative approach is just, why not? Honestly, because yes, Western medicine is very necessary. If, they have a cancer and they need it removed, or they have an infection in their uterus and they need it removed. Yeah, they need surgery. Like, they need a direct treatment right now. But what can we do to also help their overall body condition and their health from a perspective of maybe nutrition changes or rehab changes or some other, fecal transplants for certain diseases like allergies, can help. So doing that more proactive component, which is more of that alternative. Chinese tends to be more proactive and Western tends to be more reactive. And when I brought the two together, I was just amazed. And, the thought process, just like, this is, giving my clients every option just seems like what my oath is for. I mean, my job is to help the pet, and there are some people who are not comfortable with medications, and that's okay. I can help you in this way over here. There are some people who don't believe in Chinese or West or holistic, alternative medicine, and that's okay. I can give you these options over here, and I can talk to you a little bit about this stuff and just put a bug in your ear. And if you decide to open up to that down the road, great. I think from a veterinarian standpoint, there are a lot of veterinarians, and I work in Western medicine still, and there are a lot of veterinarians who just pish posh on, any sort of alternative therapies and options. And I think that does a disservice to our profession and to our clients, because having an open mind, science is always changing. Medicine is always changing. I am never going to know everything, and I don't ever expect to, because there's always going to be something new coming out, and it's always going to be a little humbling and something new to learn. And it's great, because I think we just get to continue to evolve and try to do the best that we can in each moment. The things that are available now, if I had those 6 years ago with my senior, I might have gotten more time with them, but they weren't there. There's nothing I can do about that. So I think it is really important to give people every option. I know at least in the US, there's not like a definition for holistic vet. So I do know that we use that word a lot. And I think that, if I was a Western vet, I could just say I'm a holistic vet. There's no definition for it according to like RAVMA and things like that. So using more like complementary, alternative, integrative vet is a better vocabulary for us, but people know the word holistic. So, we tend to think holistic and think more of that preventative, non-medication approach to things. But I just feel like for me and for my comfort level, to be able to offer every option is what I feel like is fair and appropriate for my clients.
Yeah, I agree. And it makes you a lot more powerful, doesn't it? When you offer it automatically just more powerful than any other vet that you can go to. And this is the thing for me. Like the more I talk to kind of specialists or integrative vets or alternative vets, I feel like you just got like so many more set of tools to help the dog live a happier, healthier, and longer life. And that is the reality of it. Whether they all work, whether they're all effective, whether they're right for every pet, that's a different question, right? This is why you have to have a chat and talk about what can work for that dog, what might not work, based on if they have cancer already, based if they have any other kind of chronic disease already. But having that set of tools in your toolbox, I think just makes you more powerful as a vet in general.
Right. Yeah. I think from like a integrative, I definitely think more like a functional medicine standpoint, like each pet is an individual. They're not all going to respond the same. Some dogs we're going to give NSAIDs and they're going to have really bad diarrhea and they're not going to do well on it. And some dogs we're going to give them NSAIDs and they're going to look like they're 5 years younger again because they're going to feel so good now, and there's just a lot of variation in that. And as long as we accept they're not all going to read the book and they're all going to respond a little differently. And that is the beauty of what I get to do with integrative medicine, is because we get to try a little bit of everything. And we're going to say, Rusty's plan is going to be different than every other pet, because he may hate going to the veterinarian. And so therefore talking about like in hospital treatments, probably not going to be the best for his quality of life. Or, if it's something about you giving him shots and you're not comfortable with that, or he's not, like that might not be the right answer. So finding the answer that is the most comfortable with the client in, their home and with their relationship and their bond is also extremely important to make sure we're keeping in mind. And I think I do have unfair but fair advantage on the amount of things I can offer, because I do get to have the open mind of I can look at Western, I can look at Eastern, I can look at, all these alternative options. And I love it.
I absolutely love it. And so when we look at kind of like you diagnose that, okay, this dog has got arthritis or, hip dysplasia, some kind of, joint problem, right? So that is the case. What is your, like, what do you do when you kind of like start working on building a treatment plans? What are kind of the tools that you reach out to first, when we look at, more natural things versus more NSAIDs or, pain medications and things like that. Yeah, what is your view on that?
Yeah, I think a lot of it depends on the client and the patient. One is going to be, can we take x-rays either financially or physically from the patient or things like that? Because it is important for us to rule out other things, right? Like bone cancers or things like that. There can be other things causing it. My dog had some weakness in his back legs and he had a brain tumor. It had nothing to do with his arthritis. So there's definitely things that we can miss by just kind of putting things on board with that and not having the diagnostics. But I do know the diagnostics sometimes can be physically or financially consuming for people. So then we just have that conversation about how we're diagnosing and treating that. I think that, yeah, definitely running diagnostics if we can, blood work, x-rays to be able to evaluate what's going on. And then when we're talking about we do have a diagnosis of arthritis, or at least a suspected diagnosis of arthritis, then it really comes down to the conversation of meeting the clients where they are and the patients where they are. So if Rusty doesn't mind coming into the clinic, then I would talk to you about laser therapy. I would talk to you about acupuncture therapy. I could talk to you about adequine injections. If you're comfortable giving injections at home, you can even do those at home. Or I've had clients who just want to bring their pet by twice a week for the first month and then monthly thereafter to get the injections. That is totally up to the
What is the
client.
injection?
I'm sorry.
What is that injection? What does the injection do?
So I'm not sure. I think it probably has the same name for you guys. It's a polysulfidated glycosaminoglycan. So it's called adequine. And there's a horse version and there's a dog version. And we also use it in cats too. It's off label in cats, but it's basically something that it goes in and helps to lubricate the joints and save the cartilage from breaking down inside of those joints. So to help kind of build back up some of that goop that's in your joints that keeps it nice and lubricated and prevents the breakdown of that stuff that causes the arthritis. So those injections are one of, the things that I like to do very early on, in talking with the company. They recommend obviously trying to start it before there is a lot of damage to the joints, because that's really where it's going to shine the most, is that early treatment where we're able to get a loading dose. Typically we do twice a week for a month. And then they only get the injections monthly thereafter. But it is a natural product, so it tends to be something that most people can be comfortable with because it is not technically a medication. It is more of a nutraceutical. So it is something that's a little bit easy on everybody. Not a lot of side effects to that medication. It just helps to lubricate all the joints and do what it needs to do. So I love that product. And again, it can be something easy that we can also show owners how to give those injections at home, which, most people can be comfortable doing. So yeah, we talk about that. And then laser therapy, which is usually like where we see people most likely know now, like red light therapy. Red light therapy really is only skin deep, maybe right under the skin layer. But when we're talking about class 3B or class 4 lasers, we're talking about light therapy that's actually penetrating down into the joint space and breaking down some of that inflammation. And that can be really powerful. Even if you only do it for a couple weeks, it can help break down a lot of that inflammation and keep them comfortable. And then we talk about things like, I do mobile acupuncture. So I love acupuncture for this. I think it's very powerful. And that is something that can, depending on your location, there may be in-home people that can do that around you, or it may be in the hospital setting. It is very small needles that, create micro trauma and bring healing proteins and endorphins and all these good things into the body to help it heal itself a little bit better. So that can be a really powerful option for people as well. And then we talk about things like I typically don't start with NSAIDs or medications unless I need to. I do like for people to have NSAIDs at home because of the just in case. The just in case always happens on a Saturday night, and you don't want to have to go to the ER and spend a couple hundred, dollars to deal with just getting some pain meds. And I also don't want you given aspirin because that's not safe. So I typically in my senior appointments always try to offer, can I get you a week of a pain medication to just have, when you feel like he starts to limp and it's a Saturday night, but he's still eating and drinking and acting normal, and we can probably get him through till Monday, but it's just a little limp, but I don't want him in pain. Something you can give and have at home that is vet prescribed for him, for his dose, and you're going to have something nice to have on hand. Or like for these really cold, rainy days, or if it's snowing and he goes outside and slips, you know, you may need a couple of days of something. I think that's great to have on hand. But I think starting with those other options first, like adequine injections or even high doses of fish oils, we do have a lot of information about fish oils. I know a lot of the other nutraceuticals like glucosamine chondroitin are kind of like on and off. UC2 collagen is another one where, you know, we have some data to back those things up, but we don't 100% know which patients it's going to work in. Fish oil has a lot of success associated with it. So things like green light mussel or just omega-3 EPA DHA fish oils are really, really good for lubricating the joints. They're also good for brain health. And overall, they're going to help our senior pets a lot. So getting them on a good therapeutic dose of a fish oil is a good place to start. There are certain diets that can be done for if they are overweight and we do need to get them to a more ideal weight. We talk about weight loss, or we can put them on prescription diets that are specific for joint health or for weight loss and things like that as well. So I try to go through all of those wavelengths first. And then, you know, we get to the point where we do medications. And typically that's going to be starting with an NSAID, in my opinion, because that's the thing that really goes in and brings down the inflammation in the joints. That's the thing that's really going to treat it at its core. Then we have additional medications, you know, like amantadine or ketamine, those what we call NMDA antagonists. Those guys really block a lot of the pain that goes up to the brain and do make them really comfortable. We also have gabapentinoids, so gabapentin and pregabalin. I am a little bit more hesitant on those with my seniors because a lot of our seniors already have some hind limb weakness or like wobbliness. And the main side effect with those is the wobbliness. So we typically say gabapentin is really good for like if you feel like they need to day drink and feel a little better, but it may not be something we stay on long term.
Yeah.
There are herbs are, you know, there's PEMF mats, so like a different light therapy mat or loops. There's a very large array of treatment options for arthritis. I typically try to tell people there's a lot we can do. I don't want to overwhelm you, but I do want you to know there are more options. So if you try XYZ and you don't feel like there's an improvement, I want you to come back and talk to me. Because it's not that we try these things and that's all we have to offer. We have so many other options. I wrote an electronic book on this, 47 pages, and a lot of that was treatment options. There's just a lot of opportunity for different pathways we can take with this, depending on how they respond to certain things. And
yes. Absolutely. I love that. I love that. And I think this is brilliant, isn't it? When you have a dog that is kind of like not really in a really bad late arthritis stage where they just can't move and they're just like really struggling to get up and things like that. This is kind of like, look, I know my dog has arthritis, some kind of joint issue. We've realized that how do I make his life or her life as comfortable as can possibly be over the next, I don't know, 5-10 years, whatever, you know, we hope 10, but however long they live for. And when we talk about the more advanced, so I tell you what, I was doing a bit of research today before the podcast because I was, you know, I created DAFY to answer dog owners' questions, right? About, you know, in general, dog health and nutrition. And I was just digging through like the different groups, like questions that I received over time. And one of the like most common questions that came up to me is the fact that is that medication called Librela that is normally prescribed for dogs that actually have quite an advanced case of arthritis, that they're really in a bad place. They might have tried a lot of the kind of acupuncture, or they might be still doing acupuncture, laser therapy, or they're like more natural therapies, but they've not worked necessarily. And there is so much anger on the internet about, you know, some dog owners having really bad experiences and some vets having really bad experiences, and some that say, actually Librela saved my dog life. Like we could have not, like, it made my dog's life the last 5 years the best he's ever had. And I was like, it's interesting. I love to get your take on that medication or medications like Librela, and what you think from your perspective.
Yeah, so Librela, the cat version is called Solensia, but it is an anti-nerve growth factor. So it basically goes in to the body and it attaches to these antibodies, and it blocks the pathway for pain sensations. So there are studies in humans that the anti-NGF is needed for normal healing of the body, for like normal processes that happen. So they haven't really pursued further testing in humans, because they did find when they did these injections, like the human version, that they did notice some worsening changes in some joints. But it wasn't across the board. And I think we do see that with some dogs. And it is interesting because this is almost as controversial of a topic in the vet med world as like integrative medicine. But it does have a lot of people on two very far sides of the fence. I think if you go to Facebook and you look up, Librela, you can find some really terrible things that are going on. I think we have to think about a couple of things when it comes to Librela. It is my last choice. And that's only, in my opinion, because I do believe that there are some potential side effects to it. We don't 100% understand all the things that it could do. In theory, it is not big enough to cross the blood-brain barrier, so causing issues like seizures or things like that should not be scientifically possible, right? But we don't 100% know everything about it. We don't know anything 100% about most drugs at this point. Other things are, it's causing cancer and all these things. I don't know that I buy a lot of that. I think that when we do studies and research in senior pets, it's very hard, because unless we screen those pets with a full body MRI and blood work before we give them anything, we have no idea what's hiding under there. As we talked about, a dog that had cancer all through its liver was fine 2 weeks earlier. Perfectly normal, eating, drinking, happy, healthy, whatever. So there is, in my opinion, a good risk of us giving them Librela. They feel good. Like, it blocks their pain, and they are like, I'm going to go run. I haven't run in 3 years. Watch me run through this backyard. And I slipped and I fell and I ruptured my splenic tumor that was sitting there doing nothing until I popped it. And it was going to do that anyways, but we got really active and we made it worse. Or our joints, there's a lot of arthritis in those joints. And now I don't feel that pain as much anymore. So watch me go run. And they're so happy, but they're worsening that arthritis. Like, those joints are going to look worse after Librela because they feel so good. But if they don't feel it, is it really the worst thing if we're in the end stages of arthritis? So I think Librela has been doing fantastic things. I've given it to a lot of patients and I've gotten really good results with it. The main thing that we note clinically with it is that it may stop working or it may not work. The body basically can create antibodies to it and stop responding to it. So after 6 months, you may get this honeymoon phase where it doesn't work anymore. But in these patients that are doing multiple other things, or they can't do these other things, and Librela is their option, or pain or euthanasia, why not give them an opportunity, in my opinion? So if we're at a place where, and that's my conversation with clients, is to say, look, this is typically what I'm going to choose last. But I do think it's a great drug. I just think that its entire job is to just block pain. So when we're finally at that point where we just really want them comfortable for a period of time, and we know we may only get a few more months with them, why not try?
Yes.
So I think that's my place with it. I definitely know a lot of surgeons that hate it, a lot of rehab vets that hate it. I know a lot of people who use it as like a first line defense. I don't really love it for first line. I think we need to go with the things that actually treat the arthritis. But I don't know that I fully buy into it causing cancers or, a lot of these major things that are going on. I think that it can cause worsening arthritis because they're comfortable. I think that it can worsen some neurologic diseases. So I'm hesitant to use it on dogs that may have like geriatric laryngeal paralysis and polyneuropathies, dogs that have histories of like vertebral disc disease, that have some nerve changes already, have any sort of neuropathies where they're having a slow breakdown of nerves. I am more hesitant on those patients because I do fear that it could make those things worse. But I mean, it's definitely going to be controversy. I don't think that it's fair to hold it from our pets in their end stages just because we don't trust it. I think it's important to know more about it and to be able to offer it to our patients that qualify for it.
Yes. I love that. I love that because you explained it beautifully from a perspective of kind of like you're hiding the pain. So the dog goes and run and like the owner might not even necessarily be aware because they see their dog becoming a puppy again. They love to see that. And actually voluntarily, you might just do more damage than good. By using that. But I agree with you. And the reality of it is, if you're a dog owner, you love that dog more than anything, and there is nothing else that works. And the dog is kind of at the end of their life, and you just want to give that dog just a little bit more happy time. You do it out of love, and you just risk it because it's worth. If it works and makes that dog happy for a little while more, then I can see why people will go for it. But yeah, I agree with you. People should be aware of the implication of it, especially when it's kind of like an early sign of arthritis and something that can be managed with, acupuncture, laser therapy, a little bit of NSAIDs, for example, every now and then. So yeah, I love that. I absolutely love that. And can you tell us a story of like a success story that you had doing a little bit of an integrative approach? So I see that you love sharing stories on your Instagram. So I just wanted to ask you, if you can think out any patients you worked with, what's one that stands out that, you would consider it as a success story that you had?
Yeah. So I had this chocolate Labrador that I saw for a couple years, and his mom loved to take him on hikes. There's this park near her house. She wanted him to be able to go hike in the woods. He was a little bit overweight and he was just a happy old chocolate lab. And she was doing anti-inflammatory therapy NSAIDs through her veterinary clinic. She had some rehab therapy, some things that she was doing there. We were doing a weight loss program. She called me in for acupuncture. So her hope with acupuncture was that we could maybe decrease some of his medications because he was on NSAIDs and gabapentin at the time, and be able to have him go on his long hikes again that he really enjoyed doing. We were able to, from that integrative approach, we were able to, with acupuncture, get him to the point where he would go hiking with her again. They would do 3 to 5 miles. They go through like creeks and all these things. And it was amazing to see his transformation because he had gone from not even really being able to make it to the trailhead to doing the whole hike and just wanting to keep going. And we were able to decrease his medications a good little bit. So we got get him off the gabapentin. He was just on NSAIDs and she was using it, I believe, just once a day by the, end of those things. And she did try Librela. We talked about Librela. It was when it had first come out. She tried it twice. He didn't really respond to it. So we just decided, why keep doing it at the time? So yeah, between those things, the movement that she was able to give him, the exercise she was able to give him, the acupuncture treatment. I also do laser therapy in the home when I'm doing acupuncture treatments and, rehab and those things. He was able to really bounce back, and have a fantastic quality of life. And on the other side of it, so he did really well for quite a few years. It's interesting. I get a lot of people who call me and we're in the state where they'll say, I just want him comfortable. I feel like he's in his hospice life. We're at the end stage, but I just want to do what I can and keep him comfortable. And then we do what we can and we give him another 2 years, and they lived in hospice for 2 years instead of a few months. Careful what we wish for, because we may get them much better for a period of time. I have a dog that I did acupuncture on yesterday who had some really bad joint issues, and he had a tendon issue and nothing else was working. He was a therapy dog. His mom was going to retire him the end of 2024. when I started seeing him. And within 2 months, he was completely normal from acupuncture. Nothing else had worked for him. And it is a year now. He goes to the Ronald McDonald House and does therapy with the children 4 or 5 times a week. And he's back to going on hikes with his dad. His dad does bird hunting, so he goes back out with him and gets to run around and things like that. And it's just amazing to see this dog that she was going to retire regardless of what we did. She was like, I'm just going to retire him. I just want him comfortable. And then it's been a year and he is absolutely not retiring. And he's going to turn 11, a black Labrador. He's going to turn 11 in a month, and he's better than ever. Yeah.
It's beautiful, isn't it? And I think that when I look at like integrative vets, or let's call it holistic vets, right? Like, because I see kind of like, I talk to both people, like just very conventional people and integrative and kind of more of like holistic people. And when the integrative people talk to me about things like acupuncture or alternative therapies, right? Whether that is preventatives for, like fleas and ticks and things like that. Because like you said, everyone has got their own beliefs, right? Like I live my life in a way where everything is fresh in my house. Everything comes from farms. And I love that. And I will transmit that to my dog. And that's the life that we live. Like we don't have any processed sugar in the house. Every now and then we do, but not always, right? And it's just what I love, right? Is that people like you, I think, why are you doing so much of it is because you have kind of that clinical experience and success stories where you've seen with your eyes what these more natural therapies can do to dogs and their quality of life. And it's like, no matter what the people say to me, it's like, yes, there is not as much science behind it or that much research on specifically dogs on acupuncture and things like that. But there is so much of it in humans, right? And we know it works in humans. And this is what I love is hearing these success stories, because it just makes you feel like actually that's why we do it. And that's why we look at alternative ways. And that's why, and you are giving them a better life by doing that if you can, right? Again, right? If your dog is really sick and they need medication, then you have to go for that route, right? But it's just beautiful to see that a dog that was about to retire, a therapy dog, is like getting back 2 years of, good quality life. That's just beautiful, isn't it? And that is, I think, I don't know, is that the thing that keeps you going with, continuing to do what you do every day, I guess, right?
Yeah. Yeah, absolutely. I mean, it's definitely the thing that it gives you the gratification, because your pets can't thank you. They lick you maybe, but it's the gratification of saying, wow, we had gotten to the point where they had given up, kind of, that the parents had said, I guess this is like my Hail Mary. And with acupuncture, I tell people I am very comfortable being the Hail Mary. I typically am. I'm the one you call when nothing else has worked. And now they're, at the point where there's nothing else Western medicine can do. And we get here. And sometimes I do get fantastic results on the other end of that. And some of them aren't as successful of stories, but I do feel like there's a lot of learning that goes into it. There's a lot of ability to help them with other components, caregiver burden and things like that when I'm there as well. I think that integrative medicine, it's really interesting because when I was learning acupuncture's been around for millennia. It's been around for so long. And they have done acupuncture on animals historically. And when Western medicine became a thing, Western medicine kind of called Chinese medicine witchcraft in a way. It's this woo-woo stuff, don't believe it doesn't work. And now we're getting to the point where I think people are understanding, no, it does work. And you have options, whether you want to go completely alternative or whether you want to go integrative or Western, they all do have research and they all do have, and it's just different ways that you want to approach it. And none are right or wrong. I think it's helped me a lot to become a much more open person with people and more understanding about all these different opinions and thought processes for people. I do meet people who maybe do things otherwise that I might not agree with as far as how they like feed or medicate or something like that with their pet. And I may think in my head, oh gosh, I can really help with that if you just like maybe saw that a little bit more differently. But it has been really kind, and eye-opening for me to realize it's not always my job to change their opinion. It's my job to meet them where they are, to make sure they understand and to give them their options within their comfort range. And with integrative medicine, the really cool thing is that no matter who I come into contact with, I can help that pet somehow. And that's the cool thing for me. Like, that's what makes me want to learn more and more and more. Like, I want to take herbal therapy training. I want to take more rehab training. I have like a huge list of CEs that I want to do to just get more aware of these things, because I can help them in the way that they're comfortable with. It's not just like when in a Western appointment where someone comes in and says, that I'm not comfortable with that medication. And I say, well, I guess your dog's going to be in pain. And that's the end of the conversation. Like, there's not much else I can do. In my world, I've tens of other options, right? I just have to find what they're comfortable with. That is the part that I really enjoy, because I do get to follow my oath and I do get to help each pet, and I do get to help their comfort levels and their pain levels and their quality of life within the aspects of what their pet parents are comfortable with.
Yeah, I love that. Honestly, I love that. Really love that. I think, like I said, right, it is the most powerful tool a vet can have. And I honestly, where I live, I just do not have access to an integrative vet, not a senior integrative vet, an integrative vet. It just doesn't exist around here. I mean, there is one, but it's not been taking clients for the last 5 years. So, but the beauty is that now people like you, right? Like, sometimes there is so much like you can help with just being on the other side of the world through like a call. And that's, I think, what pet parents are starting to realize now. And this was my biggest frustration, because I used to see dogs in my care, right, with allergy each year, like limping all the time and things like that. And it's just like the vet would just like, okay, yeah, let's put him on Apoquel, let's put him on this and that and medication and here and there. And it's just, that was it all the time. And it's like, oh yeah, I need to go back to the vet in 3 days time because he's still itching his ear, even if he's got Apoquel. And I'm just like, there are experts out there that are incredible and incredibly knowledgeable around, some specific topic like, allergies, senior pets. And I'm like, it's all about putting it all together in one place so everyone can have access to them. And honestly, Lily, you just described kind of like why I'm doing this. And it's just beautiful to have people like you out there. And I just want more people to know about it, really. That's it. It's as simple as
Yeah.
that. So yeah, I love it.
Yeah, I think that, what you're doing, what I'm doing, I think one of the things that we don't realize when we're doing it is something you said earlier, is I'm learning from people, because people will come to me with, I heard this, what do you think? And I may not know it. And I get to look it up and I get to learn more, and I get to bring that into my wheelhouse of options for people, or at least know what to talk about when they bring things like that up. I've learned so much after starting my social media account. I started it after my heart dog passed, and it was a way for me to kind of cope a little bit with it and just to make people feel seen and not alone. And it has become a business, right? Like, it's become this whole new spectrum that I get to help people. I get to have conversations with people in other countries and give them arm them with all this information that they can take to their veterinarian, or, integrate on their own. And it's so powerful to have the ability to impact not just people local to me, but also people on the other side of the world and more people. It's been really powerful and amazing. And I could have never imagined that I would be here and I would know as much as I know, but it's amazing.
I love that. So you have a community, right? Can you tell the audience about your community a little bit and what's in there and how people can join it?
Yeah, so I have a community called the Senior Pet Connection. If you find me on social media, you can find it on there. I also do have my website up and running, seniorpetvet.org. So if you go to there, you can look through everything. And the connection is really a place for pet parents to be able to communicate with each other, talk about anticipatory grief, talk about how you handle those situations, how to deal with the hospice palliative care era of their life, any questions that they may have that they want more of a perspective of not just everyone on the internet, but have a little bit of like a vetted community where they're going to give you science data to give you some good insight and to really just have people to talk to about these things, because we know even with family, sometimes they just don't get it if they've not been there. So I think what I was missing when I had Floyd is what I want to give people the opportunity to have. It's a wonderful community. I'm on there all the time. I'm in a couple times a month doing conversations like this, a kind of podcast style. I have a food therapist on next week that I'm going to talk to, Dr. Jen, who we talked about anticipatory grief previously, another friend of mine who's a rehabilitation veterinarian. We have those conversations. They're recorded. People can go back and listen to them and get some insight for their senior pets. And then there's also some courses in there right now about arthritis, dementia, nutrition, transitioning into hospice, palliative care, quality of life, pain scales. Any resource that someone asks about, I'll create a document about it and I'll pop it in there because I want to make sure they have everything that they need. So I really just want that to be a place for people to have access to information that is not fear-mongering in any way. It's not pushing you in any direction, but it's just arming you with all the information and making you feel not alone and seen and heard and understood. So that's the connection. I am transitioning. We're working through creating a program that will be live in January. Will be a 6-week course that people can go through as well. And it's going to be basically just like, hello, your dog or cat is a senior. Take this course so that you can understand what changes they have and what they're going to need. And you are going to feel so much more confident and not have to Google search or ask the interweb and get fear-mongered into XYZ supplement. That's not going to work and you're going to waste hundreds of dollars. I really want people to have just like a program that explains it all and gets them like all on this nice little playing field of like, I know my senior, I know what to look for. I know how to monitor. I know how to look up things. I know how to take care of them. And I feel confident in that. And I feel confident in what questions I can ask my vet and how I can connect with my vet. And if I want to find integrative or more alternative therapies, then I have the ability for all of those things. I just want to give people like a baseline that they're able to be at with that. So that's what the program is going to be. I'm hoping to run that kind of year round, but it will have a launch date early January.
Amazing. Is that going to be within your community or is that going to be a separate thing that people can do?
Yeah, the community will have access to it. I'm going to make sure that they're able to go through that. But it will be external first. So it's a way for people to go through a program and, have this one-off fee where they go through this program. And if they love the program and they love what it offers and things like that, then the hope is that they will transition into the community and be able to stay in there with other parents and continue that. But if they go through the program and they feel like I'm set, I'm good, I don't need anything right now, then fantastic. I love that for you and come back when you need it. So, it's always going to be there. I just want it to be able to be something where instead of having a monthly fee or a monthly membership where they feel a little bit more, I think, tied down, or if they don't know me very well and they don't, maybe we don't jive, they don't know yet. It's a way for them to just be able to like do one-off, get a feel for what they need, what they may or may not need going forward, and then, decide on the other side.
Love that. Amazing. I will put all the links when the episode goes live in the show notes so everyone can access that.
Yeah.
But honestly, I know we are a little bit over time, but just wanted to say thank you so much. I could be talking to you all day. Absolutely love today's chat and I just can't wait for any future ones that we have. You're just very good and very knowledgeable and very passionate and I just, loved it.
I really appreciate you. And I appreciate this conversation. I love what you're doing for the community. And I think that people are very lucky to have someone like you in this realm. So I think that the things that you're offering to people is amazing. And I'm glad that I get to be a part of it. And I anticipate we will have many more conversations.
Thank you. I know for sure people will love this conversation and I cannot wait for it to go live. Yeah, thank you so much. And thank you so much for watching and we will see you on the next episode. Thank you for watching. If you found this episode helpful, follow us on Instagram. And if you want first access to DAFY, join our waitlist now. The links are in the show notes.